The next case, though, is again pretty interesting here. This is a patient of mine, a collegiate soccer player. You can see the image on the left is her ACL tear. Again, you see a small stump there, maybe 50% left at most, if you're lucky there. She went through again the BEAR clinical trial, BEAR 3 clinical trial. These are her 9-month MRIs in the center and on the far right. Again, seeing a good ACL that's intact and healthy. She again passed all of her post-surgical metrics to get back onto the field. And we let her back on the field with an ACL functional brace. And she was having a really good season. Next slide. And unfortunately, when we again went ahead, keep going there, Shawn. This was the day of her surgery. That's what the ACL looked like. Again, we were able to get a nice repair. This is viewing the ACL stump before we put it back up. You can see a nice, robust ACL that was left. And we were able to go ahead and tease that away and see this is more of a mid-substance proximal tear. There's her 9-month ACL post-op, as we showed before. And unfortunately, when she went back to play 18 months out, she took a pretty devastating valgus hit. She had a bucket handle meniscus tear, and obviously had to go into the knee, and concerned about the integrity of the ACL. But this is looking at it, and you can see the picture on the left. This is pretty common. When the ACL heals with a BEAR, there's a lot of extra synovium that'll sometimes overgrow in front of that ACL. Don't be scared by it. Don't be intimidated by it. Don't be concerned on the MRI. Understand that ACL is there. Do a good exam in the office. She had a negative Lockman test, a negative pivot shift, but again, the concern was there. What if it retore? So we teased away some of that scar tissue, and you can see that on the left there. And the picture on the right shows this nice, robust, healthy ACL that's there. I removed the previous ACL sutures that were there. And again, really nice, healthy looking ACL. So we felt really good about this, gave her a meniscal repair. I actually saw her back the other day. She's now 5 months removed from the bucket handle meniscus, and we're getting her back onto the field in an advanced protocol now. So it felt really good about the fact that the BEAR was able to take a pretty large valgus load to the knee, withstand a torn meniscus, and still able to do everything she needs to moving on. So this was really one of those moments where I said, geez, this thing's pretty darn strong, and I don't need to worry about this nearly as much as we might be concerned about otherwise. What was neat about this, though, was all along the ACL, we took biopsies when we went back at that 18-month follow-up, and we took it at the at the insertion site. We took it up by the femur, down by the tibia, and what came back to us, and we didn't speak to our pathologist, we just sent all these specimens off, was normal ACL tissue, right? So that was pretty important to me to see, not that this was sort of scar tissue that was in there. This is tissue that looked very similar all along the pathway of the ACL. So again, one of those things that sort of lit off a light bulb that, in fact, the body is healing and regenerating and restoring normal ACL functional tissue, which to me means that there's longevity that's going to be inside that ACL moving forward.